Hello, everyone, and welcome to Beyond the Diagnosis. My name is Richard Wu, and my guest host for today is
Berni Schor.
All right, Berni, welcome to the podcast. Thanks for being here.
Thank you, Richard. I'm psyched to be here.
So, Berni, I know you pretty well. We go way back, but some of our listeners might not know you as well. So why don't you just tell them a little bit about yourself?
Okay, sure. So I am Berni Schor. I am a fourth-year medical student over at Florida State University College of Medicine, and I am currently applying for residency in pediatrics.
So I'm really excited that we brought in Dr. LaJoie for today's episode because the discussion that we're about to have is actually pretty near and dear to you.
Yeah, I couldn't agree more. So personally, I chose pediatrics for a variety of reasons, one of which being a year that I got to spend in New Hampshire working in an AmeriCorps program called City Year. And that was fundamental to my love for pediatrics, but also my love for medicine and underserved populations. I got to work in a tier 1 or low income, low resourced elementary school with children who were kind of considered at risk of later dropping out of high school. And I worked with them very closely, both as a tutor and helping them academically, but also as a mentor, a near peer, and getting to know them just on a community level and really understanding their social life. And I think Dr. LaJoie is a great person to talk to about the importance of a school system and a network for children like the ones that I got to work with, where they may not have as many resources at home that they would like to have.
Yeah, I mean, I couldn't have said it better myself. So, Berni, why don't you do the honors of introducing our guest speaker for today?
Sure. So Dr. Susan LaJoie is a nurse practitioner who is a very esteemed faculty member at FSU College of Medicine, and we love her for a variety of reasons. She works primarily in Gadsden County in the school-based health centers over there. And Gadsden County, for those of you who are unfamiliar, is a county very, very close to Leon County, where our home in Tallahassee is. And she over there gets to work with the health department and help students who are in need, whether it's with primary care, whether it's with acute care. And she's been doing that since 2007, helping them at elementary schools, middle schools, really creating a foundation over there for students who may not get to go to a doctor regularly. And she gets to talk to us about how integral this is, not just for her students' lives, but for her life as well.
All right, great. With all that being said, let's just go ahead and jump right into the episode. All right, Dr. LaJoie, thank you so much for being here with us today.
Thank you for having me. Happy to be here.
All right, we have a lot of good discussion coming up, but first, we like to get to know our guests a little bit better. And I know we just went through this really in-depth intro, but we wanted to go through some quick fire questions to get to know you better, if that's okay.
Sure.
All right. So the first question is something that we like to ask a lot of our guests, and it gives us a little bit of life advice, a little bit of perspective on how they approach day to day. But could you give us a life hack that maybe has helped you succeed professionally? So for example, some people, they say that they like to wake up super early, or, they have a certain morning routine. So, is there anything that you'd like to share with us?
My life hack is keeping lists. I keep lists for everything. And aside from helping me remember, I get such a psychological boost by checking things off of it. So even if it's something as simple as send a fax or send an email, check, I can scratch through it, and I have the illusion of productivity for my day.
I couldn't agree more. I'm a list person too. And I think I get a certain kind of high just highlighting off or checking off an item on my list. So I feel the same way. I'm going to keep the questions going, and I'm going to ask Dr. LaJoie, what would you say if you had to pick one thing that you might have been known for in college? What would you say? Would it be your claim to fame?
I think it would be having a sense of humor. That is something that I find so valuable in life. particularly when I'm dealing with stressful situations, to be able to kind of take a deep breath and have a chuckle. I was certainly known as a practical joker with my peers. So anything that can make me laugh or make my friends laugh is a good thing.
Yeah, I definitely agree. It's often an undervalued tool, the sense of humor. So this next question is actually really important to me, and it might be a little bit random, but let's see what you come up with. I would like to know your favorite breakfast food.
So this was one of the funny questions because I actually have an aversion to breakfast foods.
Oh, no.
When I was pregnant with triplets, I had to eat 3 eggs every day. And as soon as I delivered, I said, I am done with eggs. So I actually do not care for any breakfast foods, which my kids absolutely love breakfast. I make it for them, but I do not care for them at all.
So is your first meal of the day just lunch? You just skip right over to lunch?
Yes.
Wow.
Okay.
Kind of like a brunch thing, but never breakfast foods.
Wow.
That's a curveball right there.
That really was. I don't think I was expecting that. Okay. And then to kind of just close in on our fun questions, we were wondering, if you had access to a time machine, where would you go? What era, what time, and why?
Good question. So ordinarily, I tell people never rush through life. However, since we are living in a time and going through a pandemic, I would put a fast forward button on to get through this healthcare crisis. I've seen so many people suffer and so many families hurt by this. I would like to hurry us all through it. Today, I'm in the College of Medicine, and it's just so strange to be here. I'm the only one on the 3rd floor currently, and I just miss the, quote, normal things that I never even thought about and took for granted. So looking forward to getting through all of this craziness.
Yeah, I'm sure we can all relate to that sentiment. So thank you, Dr. LaJoie, for answering a few of those questions. And I'm committed to finding at least one breakfast food in the future that you'll enjoy.
You and my children.
But on to kind of the main conversation of the episode. Kind of to start off, we know that you do a lot of work around Gadsden County, but would you happen to be able to just kind of give our listeners a little bit more detail about the community that you serve? It's a very unique community, and I'm sure that they mean a lot to you. So could you just give us a little bit more detail?
Sure. So I have been blessed and privileged to work out there for over 12 years now. Gadsden is right next door to Leon County, where, as you know, Tallahassee is our capital. And when med students come out to precept with me, I say it's about 25 minutes and 3 worlds from Tallahassee. So the county has a large African-American population. It also has a large Hispanic population, particularly when it's growing season. So I have a lot of migrant workers who come through my clinic during those times. The county has a lot of challenges, a lot of health disparities, not a lot of health services, certainly not a lot of mental health services. So there are difficulties that our patients have to strive to get over. That being said, it's also a very proud community and a community who takes healthcare seriously and are really working to change the outcome for its children, which touches my heart so much that people with so little are willing to do so much to change it for the next generation.
Definitely. And, with the amount of time that you've spent within that community, I'm sure that you've seen it grow, and I'm sure you've built a lot of relationships with individual families. But can you kind of give us a bit of an idea of maybe how this community has changed over time for the better or worse?
Sure. So COVID has definitely had an impact on it. The community has been hit very hard by COVID. Most of the workers there tend to be blue collar or service workers. So it's not the type of job where you can go online and do it if you're working as a nursing assistant or a food server or something like that. So they have been hit hard economically by job loss. and also by people losing their lives. We have many multi-generations living in housing, and it's just really impossible to, quote, quarantine when you have multiple families and multiple generations living in a house. One of the things that struck me over the summer, we had kids who were actually quarantining, living in tents in their front yard because their house was so small and they did not want to infect their grandma or grandpa living with them. And that just gives you a real good picture of some of the challenges that they're up against. You and I might take for granted that we have our own bedroom, and that is often not the case. You know, you might have 4 or 5 different children sleeping in a bedroom, so you really can't quarantine.
I'm curious, Dr. LaJoie, with all of that being said, and now that COVID has been around for a little bit longer, have those adjustments changed, or are they still in that same circumstance of living in tents in quarantine?
So it's gotten a little bit better. There are still families with difficulties quarantining, but the county has been very active trying to test more and now trying to immunize more. And there are more resources available. They've gotten some seed grants to assist with housing and things like that. But it's been a real challenge. One of the plus sides is there is something called the Gadsden Health Council. And this is a group of community members who came together to address the health disparities. There was a meeting today I attended on Zoom, and it's people from the community, it's clinicians, it's teachers, administrators, bankers, and everyone gets together for an hour once a month to talk about the positive things going on and what resources are available. So instead of having all the resources in a silo where no one knows about them, this is kind of a town forum to say, hey, here's what's going on in my agency, and maybe you can use this, and oh, I just found out about that. So the county is very active in trying to change the future of healthcare.
Yeah, just to comment off of that, I think when it comes to a community, that's kind of key, right? To make sure that representatives from all different sectors are representing those who are suffering the most. And especially when it comes to increasing, we talk a lot about increasing access. It's all about getting information out there as well, as opposed to just having the resources available. So I think that's great.
Exactly. You need to ask the people who need the services, how is this working for you? What do you need? One of the things they were doing was a farm share, and it was during the day. And they said, wow, not many people are coming during the day. Well, because the people were working. So those that had jobs couldn't leave work to go get the farm share. And it might be a geriatric person would sit online, but maybe couldn't stay online for too long. So they had to adjust some schedules. And you do that by talking to your community, not assuming you know what's best for them, but by asking them, what can we do to make this better? And as clinicians, you learn a heck of a lot when you ask the questions.
I completely agree. I think that actually leads very well to our next question, which is talking about schools and how that is a really critical resource, especially for a community like Gadsden County. So I guess for the listeners, could you just kind of explain a little bit further the resources that you provide or that your team helps provide for specifically the pediatric community over in Gadsden County?
Sure. So our school-based health center, and we call it a health center, not a clinic anymore, because the goal is to have health, not just treat illness. So I think that was a big paradigm change, like saying, no, it's a health center now. So we partner with the Department of Health, and the Department of Health provides the nursing staff and the supplies and immunizations, things like that. The Gadsden County School Board provides the physical location. So they have clinics set up on the school property. So they give us the buildings and the custodial staff and things like that. The College of Medicine provides the clinicians, so nurse practitioners, medical students, physicians who come out and work. And it's truly a partnership. So we all complement each other and are able to bring a different skill set to the table.
Yeah, that sounds like true interdisciplinary care right there.
It is. What a concept. Yes, and it actually works well. And our patients love it.
So just to clarify that a little bit, I think a lot of us, whenever we think about school clinics, because we don't have too much experience or knowledge when it comes to that, you think of a clinic that's literally in the school that they send kids to whenever they have a headache or something throughout the day. But these resources that you're providing at this clinic, it's actually comprehensive primary care,
health center,
preventive care.
Yes.
Okay.
Yeah. So back in the day, certainly when I was a child, you would go to the clinic and you would get a Band-Aid, and that would be the extent of the care you would get. The clinics we have set up today, or health centers, we do a lot of primary care, which is important for our patients who are uninsured or underinsured. So we do a lot of well child care. Important thing we do is the school entrance exam. And in Florida, you have to have that exam in order to enroll. So if we have kids coming from other states, they need to get that exam so they can enroll in school. They need to enroll in school not only for the academics, but also they get their 2 meals a day, which for some of my patients are the only 2 meals they get. In addition to the academics, they have access to our health center where we can do well child exams, we can give immunizations, we can administer medicine, we can work with the primaries if they have one on monitoring chronic diseases like asthma and diabetes, which we see a fair amount of. And for kids who don't have any insurance, we can treat their acute things as well. So it might be using Dermabond to repair a laceration, or giving someone the meds to pull them out of an asthma attack.
Seems pretty thorough. So that's excellent. I can imagine there are several of the students in that population who don't have a primary. I don't know what your ratio is normally, but it sounds like the majority of your students are usually coming in because that's where they can only get their care. Is that more or less correct?
So some students do have a primary, but it goes back to access of care. So if your primary is available Monday through Friday from 9 to 5, and your mom or dad works a job then, or maybe doesn't have a car, a lot of my patients don't have reliable transportation or any transportation. So even though they might be insured or covered, they just can't get to the provider during the normal hours. For the migrant children, this is especially true because the parents leave for work at sunup and get home when it's dark. So the only other option would be to go to an emergency room for non-acute issues, and you wind up waiting a long time. And certainly these days with COVID, the last place you want to be sitting if you're relatively well is in an emergency room. So this gives the people and the parents and the children another resource.
Absolutely.
Are there any qualifications that patients need to meet in order to receive care at the health center, or is it open to pretty much anyone?
Good question. So our services are always free, compliments of the dance marathon. So you do not have to pay. We don't even have a sliding scale. A lot of the federally qualified health centers have sliding scale. Because of Dance Marathon, we are able to provide our services for free.
Wow.
So as long as you are a pediatric patient, and we see patients from birth through college. I have patients who have graduated from high school but still don't have a primary care provider or access to care. And if they go to a trade school or college or something like that, they will still come back to see me because that's their resource. That's what they use.
And you mentioned that a lot of the children in that area are of Hispanic origin, and that makes me wonder what kind of translational services are available for them, if that's the majority, or is that a resource that you find difficulty getting?
So we partner with the PACE Migrant Center, and finding any translation resources are always a challenge. But one of the first things I did was get to be real good friends with the folks at the Migrant Center. I work with the migrant recruiters quite a bit. They call me about, medical questions, and I call them about translation services. And in addition to just simple translation, I rely on the recruiters to tell me about the cultural aspects too. I realize I'm a white woman going into their community. I don't understand the nuances, and I need someone to explain that to me. So they many times will tell me revelations that I would not have guessed about someone's culture. And they'll say, no, you really don't want to do that, Susan. You want to do it this way instead. And I will say, okay, excellent. Note to self. I did not know that. So they keep me honest.
Very well said. And I definitely respect your open-mindedness when it comes to cultural sensitivity and respect. One thing that I am curious about is I think we, again, talk a lot about access, and I feel like a lot of times neglect to talk about continuity of care. And I think my question is, when it comes to, I guess, non-English speaking patients or patients with English as their second language, are there any kind of positions at the health center that take kind of like a care management role, that call patients to remind them of their appointments or maybe their treatment regimens, anything of that sort?
Not officially, but again, this is where I rely on the migrant recruiters. They know the families very well, and they know who needs extra help or extra reinforcement. And they will call patients. And it's funny because many times I don't even have to ask them. I will say, I saw this patient today and I'm concerned that they really need to stay on this antibiotic for the 10 days. And they said, we're on it. We know the family. We know we need to remind them. So it's already on our radar. We've worked together long enough that, it's a great dance we have going. We really can anticipate each other's needs.
That's great. I guess moving forward, we talked a little bit about Dance Marathon. In terms of funding, are there certain gains that you hope to achieve for these health centers moving forward? Are there certain aspirations that maybe more funding could provide for you guys?
Well, I took a trip to Miami a few years back with a National School Health Convention, and I saw some of the school health centers down there, and I was amazed because they have full dental suites in the school health centers. And dental issues are a huge problem for kids, as we know. Dental caries are so prevalent in the population, and particularly in underserved communities. So when I walked in there and saw full dental suites, some of them even had an optometry suite, so they could do eye exams right on the spot, and they would get the kids glasses. We don't have certainly that formal a program, but we have those referrals in place now. So if I had a magic wish and I could get a dental suite, that would be it. That is something we could definitely use. Right now, we work with an FQHC to get those kids seen, and it works. They are seen, but it does involve the parent having to take them to a separate location. We do have a team of dental hygienists who come out to the schools and they rotate. So they do cleanings, and they don't do any extractions, obviously, but they do cleaning and sealants and things like that to help with the dental situation.
Yeah, and I think that ties in pretty well to the next question. So you mentioned that, obviously not having resources such as dental care or optometry care makes your care a little bit more difficult. So can we kind of delve into maybe some other challenges that you face day to day at the clinic? What makes your job difficult? What do you wish is maybe different?
Well, the one thing that I have absolutely no tolerance for is bureaucracy. And this is especially when I have a sick child who needs something. This is the one time I can get very snarky if need be. If I have a kid who needs something and I'm told, well, it's going to be, X number of weeks to get this child in for an exam, I find that extremely frustrating. And I wind up spending a lot of my time usually calling the physician directly and haranguing them to where they say, oh my God, send the kid over now. Okay, this kid needs a cardiac consult. One of the ped cardiologists I work with is just wonderful about seeing kids when we need him to. So I think through the years, people have learned that if we call for a referral, it's really needed, it's legitimate, and the child needs to be seen sooner rather than later. And then they don't have to deal with me.
Not when you're mad and snarky.
Yes.
I that leads me to kind of wonder, as medical students now, I think Richard and I can agree that we have this sense of idealism and hope upon leaving medical school, but real life can get in the way. So what advice would you give to students like us, PA students, nurses, really anybody going into the healthcare field that may not be as familiar with these kinds of challenges, especially with rural populations like the ones you deal with? What resources would you recommend we learn from, and what would you say is the best way to kind of get involved?
Well, the first thing is to remember why you went to school. And that kind of keeps you honest. Say, I wanted to do this to help people. So that kind of puts it all in perspective going forward. One of the most effective things to do is to learn resources before you need them. So the first few weeks when I was in town in Gadsden County, I went around meeting anyone who would see me, basically. So whether that was physician groups, dental groups, social workers, just kind of finding out what they do, how we can work together. And that's been a tremendous help. The challenge is people move and they change positions. So it's kind of funny because usually the faces stay the same, but the business cards change. So I was on a call today and I saw some dental resources that are at a new facility now, still are a great resource for me, but I didn't realize they moved. So kind of keeping up with your community to find out what's there. And I think anyone who has ever had me for a small group facilitator will tell you one of the things I say most often is medicine is a team sport. You cannot possibly do it or know it all. So by having a diverse team and humbling yourself to ask people who may not be in high-level positions. I work with a lot of nursing assistants, and the ladies I work with grew up in the community, know the families, know the resources. So I'm asking them almost on a daily basis for help figuring out referral programs. And they know so much more than most clinicians do. But you have to ask the people who know.
Yeah, I definitely agree with everything that you just said. When it comes to team-based care, every single member on that team has something important to contribute. And so now I know that there are going to be some medical students or individuals who are interested in working in communities such as Gadsden County. And I wanted to ask if you feel like there is a shortage in terms of the workforce, and whether that's kind of across the board. Is it a physician shortage? Is it hard to get primary care physicians out there? Or what do you think the situation is like in that regard?
So the situation is such that we always need more help, whether that's primary care providers, specialists. There's very few specialists in Gadsden County. If you need a specialist, chances are you're having to come over to Leon County or, a different direction. But we just don't have a whole bunch of specialists like endocrinologists and things like that. As far as the other help, it's really hard to keep nurses in the position because DOH, does not have super competitive pay. It's hard work. It's long hours. So we've had a lot of attrition in the nursing roles. And I guess that's one of the challenges too, with the constant turnover of staff. The good news is, as clinicians, there's always work for us out there, and there's always challenges. And there's always patients who really, really appreciate the fact that you are trying to help them in life. I think that's one of the most humbling things. Prior to coming out here, I worked in a private practice, a rather affluent one, and I loved it. I love my patients. But working with the patients I do now, it just absolutely touches my heart because they are so vulnerable. They need help, and they're so appreciative for everything that we do for them.
Well, I don't think I could lead into the next question any better than with what you just told us, which is, what would you say, if we are gearing towards wrapping up here, are the positive takeaways, success stories, anecdotes that you have that you think about when you do have those hard days and you think about staff shortages and resources depleting, that kind of thing?
Well, going on 13 years, obviously, I like it out there. When I started, it was just like, wow, this is so different. I'm used to working in an area where you just make a phone call and you have referrals at your fingertips. This is much more challenging in that area. But again, the patients are so appreciative. As a clinician, it's fun because it kind of stretches you more. You have to think more on your feet and say, okay, how am I going to solve this little dilemma? So I like the constant challenge of that. I do love working with multidisciplinary teams. One of the things we've started out in Gadsden is mental health component, which is a huge need. So we actually partner with FSU Multidisciplinary Center, and we partner with psychologists in Immokalee who are Spanish speaking. So we now have a telepsych program on our computers, and that is so amazing and high tech for Gadsden County. It's new age, and people are just amazed that we can do that. It's kind of funny because our internet is not fabulous. So I work off of an air card, but it's enough of a signal so the psychologist can communicate with the patient.
Wow. Well, thank you so much for leaving us off on a positive note. I think all of us definitely need more of that positivity given the times that we're in. And I think that pretty much does it for our conversation today. So again, Dr. LaJoie, thank you so much for bringing this perspective to us and shedding so much light into what you do. And we really hope that throughout COVID, your services are even more impactful than they already are.
Well, thank you. And I would say if you guys have interest in learning more, the Migrant Clinicians Network is an excellent resource online. American Academy of Peds actually has a school health site, as does CDC. So if there's an interest in learning more about school health and all the great things it can do, there's lots of resources out there. And of course, you can always call or email me. Love to talk about it, obviously.
I do too. Thank you so much, Dr. LaJoie. We really enjoyed talking with you.
Thank you. Stay well.
All right. Thank you, everyone, for tuning into our second episode of Beyond the Diagnosis. And if you want to find our episodes, you can search our YouTube page under Florida State University College of Medicine or our Facebook page, Florida State University College of Medicine, Alumni and Friends. Again, I'm Richard Wu.
And I'm Berni Schor, reminding you all to eat your breakfast.
And this has been Beyond the Diagnosis.